How are you doing, y'all? My name is David Joseph Bersenio, and today I'm going to talk about the ACL reconstruction and how it applies and the methods and how further research can be used to explore new possibilities. So, first things first, we're going to start with what is an ACL tear. So, an ACL tear is a tissue that connects the thigh bones to the shin bone at the knee. And again, most ACL occurs during certain sports such as basketball, soccer, football, skiing, and so forth. Excuse me. But this is due to the fact, though, that all these sports are very cut and stop motions that can cause a shifting or tear or a quick sudden jerk of the knee, causing it to tear quickly. Because look at it, basketball and soccer specifically, and football, those are stop and go motions. Therefore, when a player comes to a brief stop and then cuts or moves to a different direction, either vertical or lateral, it will have an increased chance of tearing the ACL. Along with that, the symptoms include knee swelling, instability, and pain, of course, and then treatment will involve either physical therapy or surgery. But today we'll be looking at the surgery side effect. Excuse me. And so, example of what it looks like. So, an ACL injury is, again, it says a tear or sprain of the anterior cruciate ligament and one of the major ligaments in the knee. So, as you see, we have the femur and the fibula, and the ACL and the PCL, and that tear again is from that quick shift, either going left to right, from a shifting opponent or from cutting, down the lane. Either of these examples, and again, this is a sudden jerk, not prolonged, but a quick twist. So that's why a lot of these again happen in these fast-paced sports that require stop and go motions. So, what are some treatments? Like I said, we talked about physical therapy, but today we're going to be looking at the reconstruction of it, though. So ACL reconstruction is a torn ligament removed and replaced from a tendon, either from the knee or from a deceased donor, and is usually due an outpatient procedure and is performed through small incisions around your knee. So meaning, though, that most common procedures will either be done from the patient or athlete themselves, or from a donor graft. But there's a third option, though, that we'll be talking about later, is using the requirements of stem cells. But there's a lot of political and ethical debate on whether or not stem cells should be using. So then it becomes down to donor and personal or self-use tissue. And donor has its risk with it having a high rejection rate, and self-use tissue having we know, a year-long layoff and increased pain, since you are taking it from the athlete themselves. And the surgery is performed by a doctor who is specialized in surgical procedures at the bones and at the joints. So we're going to look at some ways to prevent this, though. So to prevent an ACL tear is that, we want to focus on implement training, specifically strength training. Get the knee nice and ready for those cut and stop motions. Balance is a big issue too. Again, you're going one way and you turn, and if you are not focused on your balance, this could cause plethora of things, but ACL being one of them. The major one I've listed was the warm up and stretch. I see a lot of athletes or a lot of colleagues that they won't even begin any exercises. They'll just go in, as they say, cold, and allowing the body to warm up, allowing the muscle fibers and your nervous system to be mentally and physically ready is a great way to prevent ACL tears, because it kind of gets the body in this flight or fight idea, and it allows the body to become warm. Therefore, warm up. Again, using proper footwear. Obviously, if I'm playing soccer, I'm use soccer cleats. I'm not going to use baseball cleats. And again, if you have a certain disability or a certain condition that may make you prone to ACL tears, we may have to look at another sport. And that's where a sports medicine specialist will come into play and recommend something different. Or if you are going to want to approach, let's say, soccer, football, there might be some preemptive measures to take in order to prevent an ACL tear. And again, so this is where we come into some further research and development that we can find. More clinical trials, separate morals and ethics from science, which again goes to the stem cells. Allow the use of 3D printing, which goes into computer programming. The use of stem cells goes hand in hand with the separate the morals. And also more extensive research on the methods of reconstruction to allow players to get back in play. And again, stem cells, super ethical, super political debate. It's hard to get a serious answer, but there have been seen of progressive treatments for Parkinson's and diabetes that if we were to utilize, we would actually be in a further developmental progress into getting ACL reconstruction quicker and better, helping these athletes getting better faster and be able to get them on the field. The use of a donor, again, like I mentioned earlier, it has a high rate of rejection, 20-30% of rejection rate. And even though, so that's one side effect. And also, when you use your self-own, there still is a rate of rejection, about 5% for using your own, either hamstring or patellar tendon or whatever you use. That's why we may even use 3D printing, which could be not only, which prevents donors to rejection and the use or take away the use of the athlete's own tissue, which prevents recovery. But at the same time, if we use a 3D printing, we have to find material that would not only the body would accept, but have a low rate of rejectability. Because if the body rejects the graft, we'll start from square one. So these are probably the big key items that I would stress about having to, forward the idea of how to continue on ACL reconstruction. These are my works cited. I use some Google images, but overall, I mentioned earlier, I'm looking forward and positive to the ACL reconstruction, and I have a bright future, and I hope to see the further research of ACL reconstruction. Thank you, and have a wonderful day.